Insurance, a legacy of trust, serving Micronesia since 1938. Matson, celebrating 25 years of commitment to Guam, Micronesia, and the CNMI. Cars Plus Hyundai, home of the Kona electric vehicle, an electric heart with an SUV soul. Test drive yours today at Cars Plus. McDonald's of Guam, I'm Loving It, and King's Restaurant, serving your local breakfast, lunch, and dinner favorites for over 45 years.
Coming up on Primetime, one lawmaker plans to look at the hiring above-step recruitment over at Guam's only public hospital. Plus, with the president signing the infrastructure bill into public law, Guam's congressman breaks down the island's share and what projects it will go toward. And one island mother is home and reunited with her newborn after being hospitalized for several weeks with COVID.
Hafa and good evening. I'm Tyler Matsinani. Thanks for joining us. It's not the kind of steps you can track on Fitbit, but it is the kind of steps the Healthcare Committee Chair plans to look into. Here's more on the above-step recruitment happening at the Guam Memorial Hospital.
Ground zero for COVID-19. Without a doubt, they are frontline heroes, giving and sacrificing during our battle against the virus. But among a sea of documents, GMH has been doing a lot of hiring above-step recruitment and not necessarily hiring frontliners providing direct patient care.
I think that the danger in this type of thing is, of course, diverting funds from other critical uses.
The issue of above-step recruitment at GMH came to light during a recent confirmation hearing for a nominee to the hospital board of trustees, who was asked about above-step recruitment for a hospital marketing and communications director. According to the October 14th petition, the starting salary at Step 1 is $60,000, but GMH petitioned for a Step 10 salary of $83,000.
I am concerned that those are the things we are sidestepping.
According to the Department of Administration's website, an agency can petition for above-step recruitment because of documented recruitment difficulty or exceptional qualifications. The petition must then be posted on the agency's website for 10 days before the applicant is hired. At GMH, they've apparently had a hard time recruiting for several positions included in the paper trail. In February, they petitioned for above-step recruitment for a data processing supervisor, normally starting at a Step 1 salary of $45,000, but GMH recruited the position at Step 10, almost $62,000. In April, for a food and beverage manager, normally starting at Step 1 with a salary of $49,000, but to be hired at Step 10 at $68,000. Also in April, for a management analyst 4, normally starting at a Step 1 salary of $49,000, but petitioned to be paid at Step 10 at $68,000. In May, for a program coordinator 4 for capital improvement projects, normally starting at Step 1 at $45,000, but to be hired at Step 10 with a salary of $62,000. In June, for program coordinator 3 for their emergency health records system, normally starting at Step 1 at $45,000 to Step 10, $62,000. In July, GMH petitioned for above-step recruitment for a program coordinator 4 for fiscal. This position normally starts at a Step 1 salary of $49,000, but GMH petitioned to hire this person at Step 10 at $68,000. In October, for a hospital chef supervisor, normally hired at Step 1 at $37,000, but recruited at Step 10 with a salary of $51,000. Also in October, GMH petitioned for the creation of a position for a Deputy Assistant of Administrator of Operations. The Step 1 is at $70,000, but GMH recruited the individual at Step 18 at $125,000. And apparently that deputy will serve as the assistant to the Assistant Administrator of Operations, jumping from a Step 1 salary of $76,000 to a Step 18 salary of $134,000.
We have critical needs at GMH that must be prioritized. And if we cannot fill nursing positions, nursing positions determine how many beds we can fill over there. And we've been paying exorbitant amounts for traveling nurses, and we still have gaps in nursing. And I always believe those are critical. The hiring of specialists is of course critical. And there's been, so much talk about, why is GMH not hiring specialists? Well, they have all the authority to hire specialists and to set salaries for medical professionals as needed. In other words, if specialists are hard to recruit, we want to put money into that and recruit them.
All these steps have led GMH to now have to take a walk down to the legislature. Speaker Therese Terlahi plans to hold an oversight hearing next month on the hospital's hiring practices and vacancies.
How do we say in one breath we're trying to prioritize the recruitment of nurses, specialists, and other medical professionals, and then we hire above step for other less critical positions?
The speaker also plans to call in the Guam Behavioral Health and Wellness Center to look into their hiring as well.
They're always on the front line during any emergency or disaster on Guam, and responding to the COVID-19 pandemic is no different. But mayors and their staff apparently remain at the end of the line when it comes to receiving federal dollars to hold the line.
No update on ESF, no update on ARPA.
According to Mayor's Council of Guam President PD Mayor Jesse Allig, village mayors still have not received the millions in education stabilization funds for sports programs and capital improvement programs as announced they were awarded by the governor's office in August. They've not received one single penny from American Rescue Plan funds the governor's had for months, and still no COVID differential pay in so long the mayor's lost track.
Oh gosh, I can't confirm the actual date. It's been several months now.
The lack of funds has already had one village mayor having to cut back on providing distribution of meals from Manumco because one of his 2 vehicles broke down, and lack of funds to keep up with paying for the rising cost of fuel. Agani Heights Mayor Paul McDonald says for the past 2 years they provided the service but had to stop.
Apparently my vehicle had finally found out one of my vehicles that I use every day, 5 days a week, to deliver almost 100 lunches every day. So that's when I had no choice. So again, for almost 2 years, we provided that services, and I can not longer provide it because my vehicles, we have one to service Agana Heights, to pick up trash, to go bush cart, to do everything that we are required.
According to McDonald, the meals are still being delivered, but this time by public health with the assistance of an employee from his office. The mayor, however, says he wouldn't be surprised if other mayors fall into the same situation.
It's about providing the services to our constituents, and it's going to be critical pretty soon because there are other mayors that have problems with their vehicles and providing. And I'm actually the first one to come up and say, hey, we need that. We need it right away.
MCOG President Mayor Alex says he will be meeting with Adelup at some point and will once again bring to light the needs of mayors and their staff. Responding to BBMR's recent report about the allocation and expenditure of ARP funds up until August 31st, he was surprised other agencies were prioritized over the Mayor's Council.
I didn't send a written comment about it, but when I saw it, I was concerned that there were other entities that received money. We don't even need $1 million, to keep us going. Not that I believe, but at least some support for our vehicles, our aging vehicles, right, that we use on a daily basis, sometimes 7 days a week. That was disheartening, and that'll definitely be part of the discussions, for sure.
Reporting for Guam's News Network, I'm Sabrina Salas. That's an honor.
With President Biden signing a $1.2 trillion infrastructure bill, Congressman Michael Sinicolas gives us a breakdown of the potential funding for Guam.
Congressman Michael Sinicolas says with the enactment of the infrastructure package, it is but one of 2 measures his office has been working hard to secure. According to the breakdown provided by his office, Guam can expect millions heading our way. Through the Territorial Highway Program, Guam should expect to receive more than $95 million over 5 years with which to rebuild roads and bridges. The island can also compete for $7.5 billion in funding over that same time period for major projects to deliver substantial economic benefits to communities. Guam may also expect $11 million over 5 years to provide and improve public transportation options island-wide. Now, under the new federal law, Guam is set to receive a minimum allocation of $25 million to help provide broadband coverage across the territory, including providing access to at least 51,000 Guamanians who currently lack it. Guam can also expect to receive $2.5 million to protect against cyber attacks and funding that will help reduce energy costs for families. We should also receive more than $30 million over 5 years to improve water infrastructure. Finally, Guam airports are expected to receive about $30 million for infrastructure development. According to the delegate, quote, "The work continues, though, to secure remaining provisions for Guam and the president's Build Back Better agenda, which he said could be tackled this week."
As we reported last night, the head of the governor's physicians advisory group, Dr. Nathaniel Bird, indicated that we could see an easing of restrictions. According to a statement from Adelup, the governor and lieutenant governor are encouraged by the continued downward trend in positive cases. In consultation with the Department of Public Health and Social Services, the physicians advisory group, and her advisors, the public can anticipate a lifting of restrictions in the coming days. After 9 weeks in the hospital battling COVID, a mother is finally home and able to hold her newborn in her arms. Daniel Perez has our next story.
A day after her baby shower, Justina Garcia started to feel COVID symptoms. For the safety of her unborn child, she decided to get checked.
I went into GMH on September 6th, and I went in initially because I wasn't feeling her move. I went in just to be safe, and when I went in, I was already experiencing like flu-like symptoms. So I never thought it was like COVID or anything. So I went in, they tested me, came back positive. They told me to go home, quarantine for 10 days, and I was in contact with public health. A couple of days later, my symptoms got worse.
Due to COVID symptoms, Garcia was admitted into GMH for her and her daughter's well-being.
I lost my sense of taste and smell, and I had really bad body aches. So I went back again on September 11th, and I went to the labor and delivery ward, and they told me that I had to have an emergency C-section because the baby's heart rate was dropping.
Garcia recalls waking up after the C-section, intubated.
My first thought was, where's my baby? Like, what happened? Like, why am I here? And I was just trying to recall everything that happened. And then the nurses, a doctor came in, and he was just explaining everything to me. And I was just really just freaked out. I couldn't stop crying. I couldn't get in contact with my family at the time. So the nurses and the doctors were there initially when I woke up. But it was just a really scary experience.
For more than 6 weeks, Garcia was in the hospital recovering.
I was in ICU, and I had all these like tubes, and I was attached to a machine, and I felt really like out of it. I was heavily sedated.
After being detached from the tubes and going through physical therapy to walk again, Garcia was able to go home on November 13th.
They had to test me twice for COVID just to make sure that I was negative so that my family can come and see me. So when the second test came back negative, I was like, okay, call my mom. I was like, call my mom. I need her here now. And my mom came in when, we got that test. It was a sense of relief that I was COVID-free, but at the time I didn't know if my daughter was COVID-free until my mom told me.
Garcia and her daughter are both COVID-free and urges residents to consider getting the vaccine.
I'm not trying to say if you don't get vaccinated, this is going to happen. You're going to land where I was. That's not the case. I would just say for those, it would be a good idea to consider it, not for your safety, but the safety of others.
Garcia plans to get vaccinated. As for her daughter, she hopes a vaccine for infants will be made soon. Daniel Perez reporting for Guam's News Network.
In regional news, the NMI House Committee investigating Governor Torres finds his executive assistant in contempt after weeks of back and forth and after she appeared before the committee with attorneys but objected to the subpoena on Tuesday. Regional correspondent Tomas Manglonia reports.
Refusing to answer questions is also grounds for contempt, as the chair has noted. And I guess my first question to you is it your intention to refuse to answer any of our questions today?
I, Francis de la Cruz, hereby object to the subpoena served on me today.
Okay. Thank you. Privilege. We've heard this statement. We've heard this 10 times.
After weeks
So
of waiting
I
and a
think
written
I
affidavit,
let
the House
Mr.
Investigative
Representative
Committee
answer
finally
the
got to
subpoena.
question the governor's executive assistant, Francis de la Cruz. However, de la Cruz objected to the subpoena and reread a prepared statement.
I object to this subpoena because my employer and I have raised testimonial immunity, executive privilege as provided under the constitutional separation of powers doctrine.
Flanked by attorneys, she says in part that the subpoena is overbroad and exceeds the scope of the legislature's power.
It seems like they practice not to say anything. The governor, all the time, he has nothing to hide. I believe he should encourage the witnesses, just like what